Good afternoon, everybody. Name's Anthony Murray. I am with MRO, and today we're going to talk about facilitating seamless clinical data exchange for optimal data usability. We're going to talk about a lot of what we've been talking about across all of these sessions. Thanks for coming. Clinical information. As we know, it's really messy, especially at the provider level. It's inefficient, inaccurate, and unsecure. And it really drives a challenge when we start to attempt to accelerate clinical data exchange using more digital and automated ways. Trying to get information from multiple siloed sources where the data has very little standardization creates a lot of problems and challenges. So the fragmented healthcare data system creates a major roadblock for progress around information sharing, and it remains trapped in the silos. The diversity and proliferation of these silos are compounded by the individual level of variances, what we call localization at the different provider levels, inconsistent data forms and format and standards that are continuing to improve but still have a long way to go in order for us to effectively exchange information. And these manual processes are prone to error and require oversight and validation, which continues to drive human intervention in our ability to share information. And then we have to balance the effective digital sharing with all the privacy and security rights that can measure with our EPHI standards and with what HIPAA dictates and drives. So the consequences are that it really delays diagnosis, treatment, and reimbursement, which really creates a situation where patients continue to suffer. It increases the administrative burden of cost or loss of revenue for providers, and a reduction in the quality of patient care in general and general satisfaction. It also limits the opportunities for research and innovation. So what can we do about it? Well, we have to think about ways where we can continue to do a better job throughout the entire life cycle around the exchange of information. We have to get better at doing digital acquisition. We have to manage the data that we are sharing, figure out how to structure it and share it with high authentication, high assurances it's going to the right places, and that we can trust the data that we're getting. Through that kind of vision, we can start to build an impact that provides improved patient care, optimizes our healthcare operations to make our providers more efficient, and exchange clinically relevant healthcare information with the people who need it for the various purposes in more seamless ways, driving down the overall costs of healthcare and improving the quality. We need to apply all of the governances to assure that the security and privacy are withheld as we continue to share this information. So some of the solutions that we're bringing to the table are really focused around working directly with the providers to implement the appropriate level of governance and helping them improve their general data quality in order to get the information, understand the rigors and utilization patterns that they have within their EMR systems, and helping to curate and normalize that as we share information for various use cases. Throughout our clinical data acquisition process, we have a number of services that allow us to drive that for a handful of use cases through our clinical intelligence programs that allow us to create a more meaningful data set when we begin to share this electronically. And this allows us to look at really things like personalized medicine and treatment plans, reduction of these administrative burdens and costs, improved resource allocation and decision making for both providers and the users of this clinical data. Targeted information, being able to get delivered is of high value, and minimizing the unnecessary information to really provide insight is a goal for sharing information instead of just handing around different medical charts. So we want to deliver on that purpose and be able to enforce the quality that the providers expect, along with the assurances that we're satisfying things like minimum necessary. So with our solutions, we can start to really drive accessibility, usability, cost, completeness, and accuracy throughout the entire life cycle of a clinical data exchange. So with that, MRO interfaces with over 250 EHRs, so being able to tap into and get access using existing standards, such as FHIR that we continue to talk about and see the improvements, HL7, and connecting to alternate resources like PACS, gives us the ability to have a far reach and into a variety of native formats that we can then normalize, curate, and deliver for various reasons at scale. With our usability, we want to automate that workflow as much as possible. And in order to do that, we have to have all the assurances that we trust our templates, that we've got the privacy and the governance right, and that the data as it is in the EMRs is accurate. So we can do that through human review or the advancements of a lot of the technologies that are starting to come to fruition in order to help us assess and drive better tooling into the workflows that help, again, drive assurances that we're able to provide usability and meaningfulness. Meaningfulness is that rich implementation to deliver that most relevant information without the cumbersome of things that are necessarily unnecessary, and a high accuracy score we can drive through rigorous testing, improve on that fine-grained precision of how we extract and share information, and demonstrate validation through things like certification and results in our testing processes. So we can achieve things like DAV certification. We are working on providing template-based assurances for various use cases when we're extracting things from things like FHIR-rich resources of various EMRs. And then cost, really trying to drive down the optimization of delivering on these other 4 pillars at a cost point that makes sense for both providers and payers. What we then start to see are some results. So through this curation, acquisition, and enrichment process, and through rigorous validation, through the trust of our clients, we're able to show a 60% reduction in turnaround times for providers to payer. We have a 63% improvement on our quality measures for one of our largest payer clients out of the DMV area. And through our revenue integrity process and programs, 75% saved in audit processing times. So if we think about the pillars of automation and why we do all this stuff, it's to help drive efficiencies in the workflows and be able to deliver on metrics like this that allow our partners to really focus on the most critical things, which are not really data entry tasks or shuffling information around. It's going to be on patient care and providing a better experience for healthcare in general. And we're starting to be able to really see this program. A lot of what you've heard around the room today is all about people who are trying to accelerate very similar things. And combining all of the work that we're doing and that CMS and ONC are starting to push down is making a lot of this possible. And tapping into it in a very meaningful way is allowing us to deliver on what we're starting to see are really tangible results for our clients. So the power of getting connected to the network is the reach and breadth of getting access to the provider network. Today we're currently able to exchange directly with over 1,000 hospital and health systems, 250 plus EMRs are well within our capabilities, which represents a huge number of providers and individual practices. We got started a little late and I went fast, but you can come see us at our booth. More or less opening a chance for some dialogue if anybody has any questions on what it is that MRO can do. Yes. The IGs, the implementation guides. Yeah, so a lot of the work that we are doing is assessing the IGs and how we're doing our implementations, but we also have a variety of things that are outside of that allow us to empower different entry points into our clinical exchange. But the work that we're doing through the IGs is absolutely part of the MRO's future. So We're starting to go into the Da Vinci, but most of the HL7 is where we're really talking about. Sure, so what we see is that the privacy controls and understanding exactly what is being shared and the auditing capabilities in a lot of the digital technologies is still gapping. That creates a lot of discomfort for the providers. So how do we continue to drive technology into their existing workflows that give them the assurances that the data that they're sharing is really only being used for what it was asked for? And how do they see and feel the information that's being shared the way they would typically do it when things are manually retrieved from their systems? So through interfacing with the EMRs and creating records in what would typically be an HIM component so that we see more traditional audits, and being able to account for exactly what is being retrieved and what is being delivered, and being able to reproduce those for the provider starts to build trust and comfort with what we are sharing. So there has been a little bit of a hesitancy on the provider networks in order to just kind of throw open the doors and allow access when they don't really feel like they have immediate control over how that data is being shared, what it's being used for. I'm sorry.
You talked a lot about scale. Can you tell us a little bit more about how your approach to scale?
Sure. So the question is about scaling. So how do we do this at scale? So our platform is built on a series of components that allow us to be very modular and allow us to ramp up and take advantage of both cloud services as well as our underlying technologies in order to bring in information from a series of data sources, scale up and cultivate it, and begin to deliver it while balancing out the performance with the data needs that we have today.
Quality of HIE data.
So we are able to tap into the HIEs. I'm sorry? The question was about what are we seeing around data quality from various data sources. And what we know is that the utilization of the HIEs, particularly around treatment, even though we're starting to look at the other use cases, is still not as rich and effective as what we're able to get directly out of the EMRs. So there's a balance between speed, efficiency, and digital connectivity, and some of the quality that we're able to get for various use cases. So having a combination of being able to tap directly into the richest possible data sets, which is the last mile provider, and being able to curate information out of the HIEs where we've got quick digital connectivity, drives a very powerful and compelling story that offers us to deliver a variety of use cases for where the value is for the person requesting it. Told you I needed more slides. Thank you.